Hi, my name is Jacqueline Rojo and I'm a lecturer here at the School of Nursing and Midwifery at Western Sydney University. And I'm here to talk to you about how we incorporated oral healthcare in the undergraduate nursing curriculum. And it was a very exciting journey, but before we begin, I just want to give you a little bit of background and just give you a taste of what oral healthcare is like around the globe. So the World Health Organization do estimate that 3.5 billion people worldwide are affected by oral disease. And this figure is staggering, and traditionally dental professionals have been responsible for managing oral disease across the globe. However, this picture is now changing and incorporating, because they do identify that nurses can play a key role in screening and health promotion of oral health. So the problem with nursing is that oral care is not often seen as important as other care, so it's not often prioritised. And this has been consistently, and a missed care relating to oral health and oral care has been consistently seen or missed over a decade or so. So what we need to do, and what we have done, is that we have focused on the undergraduate nursing curriculum so that we can target this key group of people, students, who are then going to make that change in the clinical setting when they graduate. So get them all trained up. So what did we do? We did a couple of things to begin with. We first approached key stakeholders. Those key stakeholders were subject coordinators, they were senior management of the school, and got their buy-in to begin with. And we identified champions within this group who would also lead this project, And we moved then to a co-design process between students and staff who then developed the learning activities that would be associated to this module. So overall, what we did was it was all based on evidence. We did do a literature review to begin with to identify the best approach that other schools had taken on, particularly in the United States. But we adopted an approach which hadn't been used before, and that was to incorporate a learning theory to underpin what we did. And so we used Mesereau's transformative learning theory. So we moved it across two subjects. One was a theory subject based on chronic disease, and the other was a practical subject which mirrored what was being done in the theoretical component. So whilst there are many subjects, we did map across the curriculum, we did map where oral health was relevant. And we focused more on diabetes, or particularly type 2 diabetes and the risk of periodontitis. And then we mapped it across those two subjects. We had dental models, we had podcasts explaining periodontitis. We had podcasts explaining how to make a dental referral. We conducted an oral health assessment in the practical class. We had a guide that assisted students in identifying different dental pathologies like caries and periodontitis and swollen gums and so forth. So overall, it was a very successful project, and we did see an improved attitude and confidence in nursing students undertaking oral healthcare activities. So students felt more confident identifying oral pathology. So about 25% of students, we saw an increase in their confidence to identify swollen gums and other hallmark features of periodontitis. We saw an improvement in attitude as well, and they were all statistically significant findings. Now, moving forward from here, what we plan to do is mimic this approach across other subjects and move it across the curriculum in other areas, so that we're addressing oral health. So things like aged care, maybe palliative care and so forth, where these where these concepts are quite relevant when delivering care to these particular patient groups. So what was it like for me? This was part of my PhD, and what was it like for me? Wow, that's I'm thinking about this, and I'm thinking it was a very exciting journey, and it was great. It gave me an opportunity to engage with a lot of different staff in the school. We delivered education sessions for our staff. We did all of these things with the school, and it was a very exciting journey for me. And moving forward, seeing the development of this go into something a little bit bigger is a great thing. So thank you.